it, recording it now. There we go. All right. So Vincent, I'll let you go ahead and start with AMiKO.
Okay, and you're controlling the slides. Okay, fabulous.
But yeah, just tell me when you want to
Well, thank you
switch
so
over.
much for inviting me to be a part of this. I'm really excited to be talking about a brand new peel called the AMiKO MCA colostrum peel. It's a brand new entry into, well, the world of peels, to be quite honest, but more specifically the United States. We are excited because it's unique because it is the first time that a peel containing a balanced colostrum has entered the market. It's the first and only. And we're going to talk a little bit about what colostrum is. Some of you may have an idea, but suffice to say, it's the one and only. And that's why we're excited to talk about it, especially how it relates with skincare and TalaDerma in particular. So, Carla, if you would be kind enough to go forward. So we'll talk about AMiKO and how it compares with or where it sort of sits in the peel world. I've been doing peels for about, well, since 1996, actually, and I've worked with a variety of different peels. And so I'm kind of referring to this peel, AMiKO, which comes in little hermetically sealed medical vials. Let me put my glasses on, see if you guys can see that. Can you see that? Yes. It comes in a box like that. So there's 5 little vials in there, just so you guys get an idea. Hold on. Why is that happening, Carla?
From the blur, pull it back a little bit.
There we
There
go.
we go.
Okay. Anyway, there's 5 vials. To give you guys an idea, we have a great website. You'll see it at the end. It's AMiKOPeelUSA.com. But this is what I'm coining the next generation peel, one of the first. Thank you, Bridget. I'm still new to all of this. We're referring to it as the next generation peel because the traditional or first generation peels were basically a collection of acids. They would eat away at the top layer of skin to gain entry. They would do their job. You would neutralize them or remove them, get them once a month, call it a day. This is a next generation peel because it is not eating away at the top layer of the skin, but it's using its formulation to penetrate the skin to do the peeling, of course, but with no downtime, no discomfort, virtually no downtime, virtually no discomfort. You'll feel a little bit of a tingling, maybe on a scale of 1 to 10, a 1, 2. I did mine yesterday, actually, and I think I felt a 1, 2 at most. Granted, I have a thicker male skin, but it will sort of vary for everybody. But it's designed to be safe and easy to use and not eat away at that top layer so that there's no discomfort, there's no redness, there's virtually no downtime. You can go out to dinner that evening. A lot of people have been doing this to call it like an express peel or a lunchtime peel or a VIP peel. And that's because, again, it's not eating away at that top layer. So no downtime, not painful, no photosensitivity. So again, I could go right out here in the sun as I have and not get burned. Of course, I would still wear sunscreen because I'm in the skincare business and I realize the importance of that. But that's to tell you that it's not eating away at that top epidermal layer. And it's not aggressive. It's a balanced formula. And what's unique about this, and you can forward that, Carla, or just kind of guess as I'm talking. What's unique about this is it's a formulation which is containing 33% colostrum. So it is, I forgot to mention to you that it is great for all skin Fitzpatrick or photo skin types from 1 to 6. So the fairest of the fairest to the darkest of the dark without fear of post-inflammatory hyperpigmentation or any issues whatsoever. You will adjust your application and your protocol based on what you see before you. But this peel is really great for troubled skin in particular. That's another thing that makes it very different. It is self-neutralizing. It's stable at room temperature. It lasts a long time because it's hermetically sealed, and it's a quick 10-minute treatment. I will tell you that most people are incorporating it at least in a 30-minute treatment or adding it on to an hour facial. And yes, there are times that it can be sort of stacked with other treatments, if you will. We can sort of talk about that in a bit. So, what is colostrum? Well, colostrum is that first liquid that is produced after the birth of a baby. And so, this colostrum is taken or gained from bovine or cow. And it is, I guess, a part of the first press, if you will. The babies are fed. Once they're fed, there's a lot of extra that's left over and waste. So, it's ethically, organically harvested professionally. There's no pesticides in it, and everything is done without harm to any animal whatsoever. You may all be familiar with colostrum hitting the market now. I've been taking a colostrum supplement for about 2 years because it's known as the elixir of life or liquid gold. And it has over 100 bioactive compounds in it to, well, heal your gut in particular, but in this case, to heal the skin. So we know that colostrum, and this formula contains 33% of it, so it's the majority of the formula, is healing and repairing, not masking. It extends the life of our cells. You probably have all heard about telomere degradation. And so this is supporting telomerase, which is stopping the breakdown of the telomeres, which are really the thing that decide how quickly you age, based on a myriad of factors. But suffice to say, this actually supports that. And that's all coming from the colostrum. So it really is almost a nutritious peel. Yes, it's a peel, but it's delivering this liquid gold, this elixir of life, deeply into the skin to add a healing factor to it that we've not had before. And so that's going to produce collagen and elastin. It's going to boost fibroblast activity. You're getting all of your antioxidants, your peptides, your nutrients, and it speeds up recovery very quickly. We're seeing great results with eczema, with hyperpigmentation as a result of eczema, with acne. So you should feel comfortable to use it on all chronic skin conditions. And that's really the amazing part of it. It's a 10-minute treatment, best sold in a series, by the way, and it can be done as frequently as every 14 days, give or take. And if you have questions, just jump in. I'm just going to keep going here. But the bioactives at work are antioxidants, amino acids, and growth factors. So a lot of people have been talking about growth factors and exosomes. Of course, these have the growth factors in them because it's a part of the colostrum, which is the life force, right? It's what the babies get when they're breastfeeding. So we're getting a version of that, if you will, for the skin. And immune peptides. So what are we doing? We're protecting and repairing while delivering a peel. We're building or stimulating collagen and elastin to support the structure of the skin and to slow down the aging process. We're stimulating healing for chronically troubled skins with the growth factors, which are what growth factors and exosomes are meant to do. And then we have our immune peptides in there so that we also, in this very rounded formula, reduce inflammation in the skin. So think your eczema, your chronically sensitized or reactive skins would be a great client or candidate for this peel. Okay, moving on. All right, what's in the peel? You've all heard of TCA peels. This is a cousin. It's a monochloroacetic acid, which it is, I'm going to say, a gentler cousin of the TCA that's as effective without being as aggressive. And there's new guidelines going on throughout actually the world of skincare where TCA is going to be monitored or controlled. And so ours is a monochloroacetic acid, which makes it safe for all, but still extremely effective. The other parts of the formula are a lactic and salicylic acid, which we all know what those do. So we're deep pore cleaning. We're great for gentle resurfacing of the skin. We have allochuan, calming, soothing. Again, we're not eating away at that dead layer. So again, next generation peel, we're thinking about peels that are advanced. We don't have to have all that downtime or that pain or that peeling. I know that there's still people today who hear chemical peel and they want the peeling so that's not what this is. This is next generation. This is your classic or your luxury peel where again, your customer will have very little to no downtime and they can still go about their lives while getting the benefit of a peel. And in this case, deep nutrition into the skin to do all those things that a peel is meant to do without all the downtime and pain and peeling associated with first generation or traditional peels. And so you'll see by the formulation there, that's how we're getting that. Panthenol, we're boosting hydration, reducing redness, and then all of our amino acids, which we know are the building blocks to proteins in our skin to support collagen synthesis, elasticity. So the benefits will be a beautiful glow and luminosity to the skin. And as I mentioned earlier, that this is best sold in a series, you'll start to see the skin get better each time that they have a peel. So I've done a couple of series now in a row. I am actually 58 years old. I just turned 58. I think it is a great benefit. I love the fact that I don't have any downtime. I can go about my life and still look like I've got really great skin. Of course, I'm in the skincare business and take care of my skin, but this is definitely something I need. It's definitely something my age category needs, but it's actually perfect for all age categories, specifically the person concerned with aging and wanting to address the signs of aging. So fine lines and wrinkles. hyperpigmentation, melasma, sun damage, and then again, the more troubled skin like your eczemas or your sensitized or reactive or acneic skins. Okay. And
And
then,
I just wanted to add, Vincent, I know you talked about the peeling process and the new
yes,
generation peels. And I think there are a lot of consumers who have that misconception that they have to see the peeling and they have to go through this, terrible stage downtime. But they are still getting the regeneration. They're just not going to experience it because of the technology that's improved. So I think that's really important for us to be able to explain that to our clients.
I agree, because if the client doesn't understand it, they're not going to understand the result that they're getting. They may walk away going, wow, my skin is soft and smooth and I'm glowing, but I didn't peel. So obviously it can't be good. And what did I spend all my money for? We really do need to get them to understand that this is an advanced peel. We no longer have to have severe peeling of the skin, unless you want that. If you want a phenol peel, go book it with your doctor, no problem, but be prepared to go under anesthesia as well. And there's a lot of side effects and risks with that. The first generation peels, they have their job, but I think their place now is in the beginning of a facial where we're doing sort of a gentle exfoliation to prepare our skin for more aggressive or proactive treatments. Whereas this is that more elegant treatment, best again sold in a series to get to that final ultimate result. And so the science of this, the results of this, the business of this. So the science, of course, again, is the monochloroacetic acid. It's gentler, cousin of TCA, without the aggression, without the downtime and the irritation. TCA can be very, very irritating. And that's why some of your boards are going to outlaw them or say that it's not within our scope of practice. And so you'll not have to worry about with this. So this was done very intentionally. Again, the colostrum, I don't know who, if anyone is taking colostrum supplements, I am. I can tell you it makes a world of difference both in your gut when you take it internally, but for the skin as well. And so we hesitate calling this a healing peel because, we really never want to say it's healing something because that's kind of outside of our scope. But what it does is it does support healing and it does support regeneration, because if you deeply add nutrition to the skin, it has to correct and balance itself, all the while stimulating collagen and elastin, which supports the aging of the skin, right? You're managing your aging truly. You really are doing a management of true aging. So lifting, firming the architecture of the skin. So we're getting in deeply, no irritation. Results are supportive of healing, regeneration. It's safe, it's easy, it's quick to do. But again, the explanation on the menu and in person will be so important. The business part of this, why is this so amazing? Well, we have a very high return on investment. You're looking at a cost per treatment of about $21. In this box of 5 vials, which is 50 milliliters, you're going to get about 5 treatments per vial or 25 treatments total, possibly more or less, depending if you're doing face, neck, and deck or just face alone. It is also very variable. You could do back, you could do the intimate areas with this. We'll adjust the protocol slightly depending on what areas we're treating, but it's kind of an all-encompassing. I don't know. Would you call it a peel? I don't even, I think it's an age support peeling system. I think we need to come up with a new generation name for this, but this next generation peel really is kind of miraculous in and of itself. And a very easy protocol. You clean the skin, you apply this on, you leave it on depending on your skin type for about 5 minutes. It does self-neutralize, but we're going to have you neutralize it. And then you're going to put on your post-treatment cream, which I have here as well. So a pretty simple thing to do. You could do it as a lunchtime peel. There are a lot of doctors who have people coming in and doing quick peels for 15 minutes on their lunch break in their offices. We've been doing that for 25 years in the peels that I've worked with. So people will literally come in and out in 15 minutes. I think in a spa or a med spa or a different setting, this would be great to build into a 30-minute treatment, because if your cost per treatment is about 20, we're looking at an average menu price of about, Carla, we're looking at about, I mean, depending on what,
250,
yeah.
just the peel alone, yes, just the peel alone, about 250 and up.
Yeah. So because of the colostrum, again, they call it the elixir of life or liquid gold. It is a very expensive product for what it does. It's very, very expensive. So we put in this peel. So we've got the cost per treatment down as low as possible. $21 is quite competitive, I've got to tell you, when you compare it to the other next generation peels on the market. But therefore, the menu must reflect the price that you guys are paying for it. And you can get that because it's a very advanced treatment. Bless you, whoever that was. Um, So here's our protocol again, fast, easy. You can combine it with other treatments. These are more advanced protocols, and we can talk about that if you were to buy into this, but it is very stackable, as you can see. If this is a 10-minute treatment, you can imagine why not build it into something else like a microchanneling or a microneedling treatment, or even just a luxury facial where you end with this peel. So it's got so much variability in and of itself as a protocol, but as well as almost any part of the body as well. You don't have to refrigerate it like so many other products on the market. You get it, it's sealed hermetically, you pop it open, you use it. It fits into any treatment menu you see there. Literally any protocol, you could throw this in because it takes 10 minutes to do. Cost effective, very high return on investment. So if it's costing you about $21, $22 per treatment and you're getting $250 and you can get it done in 10 minutes, you do the math. How much is that per hour, Carla? We're looking at like you're generating maybe $750 or more an hour. That's outrageous.
Yep.
Most facials deliver a return on investment of maybe $100 or slightly more or less than that.
And
So,
we do have the slide with the numbers on it too.
okay, we can
We'll
move
have it.
forward
Yeah.
with that. So,
I
is that a
wanted
video?
to add, Vincent, the vials, because that's a question I get often. The vials, once you've punctured it and started drawing from it, you do have several weeks to finish that vial. But I don't think it's going to take you that long to finish it. It's about yeah, your
Very,
shelf
very
life is at least 3 to 4 weeks after first using a vial. So you have a lot of time to use what's in there.
And honestly, a little bit goes a long way. You're using 2 milliliters per face. I find that's probably enough for face and neck, to be honest with you. There is a layering process we can talk about. So if you were to buy into this, we have a few different variations on our protocols that we can talk about. So someone like myself who's got a male sort of thicker, oilier skin, you could do a couple of layers on me. On somebody who might be more sensitized, you could just do one layer on them and leave it on a little less time, and therefore extends the quantity that you're using in your vials. So all the numbers that we're giving you are the averages that we know from using the one box of peel overall. Yeah, so we can move forward there. Our basic contraindications are the usual suspects: pregnancy, breastfeeding, cancer or steroid use, anyone using or having used Accutane within the last 6 months or so, or anybody who are currently receiving antibiotic therapy. But that's pretty much it. Otherwise, it's perfect for anybody else. I would pay attention if you're stacking and you've done like a wax on the eyebrow, or someone who's sensitized, you could occlude those areas with a cream or a petroleum, which is what we did at Dr. Gross's office all the time. We would wax people's eyebrows. We just occlude that area and you can treat the rest of the face, no problem. This is the protocol: clean and degrease the skin, apply 2 milliliters of the AMiKO peel, leave it on for 3 to 5 minutes, depending on who's in front of you, what condition you're looking to treat. Neutralize, and then you would apply the Auric, which is the name of the products that go with it, treatment serum and or cream, which we have here. And then you repeat the sessions about 10 days apart. You can do 4 to 6 sessions. I judge kind of as I go along, find out what my customer is doing, what are they doing at home to support their peel results. But I've been doing it every 10 days on myself, and I think my skin only looks and gets better. And it's not, I realize I'm not objective, but I'm talking about what people say to me who see. I live in New York City, so I can walk to a million different businesses and people will always remark on my skin if I've done the peel. Generally, they know I'm in the skincare business, but if I have the peel on and I've got this glow to my face, they'll be like, "Oh, did you have another treatment?" And I'll say, "Yes, yes, I did." And I'll try to talk them into getting one as well. So the results, you will see this beautiful luminosity to the skin and this smoothness, but the real result, if you're looking for an ultimate result, which is one you'll get immediate, it's long term, you want to do that package series. So selling this as a package is another great idea. So if you're selling it for $250 and they're going to buy a package of 5, you can play games with the marketing of it, right? Buy 4, get 1 free, or buy a package of 5 and get 10% off. I've got one customer who says, buy a package of 5 now and your first one's free, which is kind of the same thing that I just said, but it creates an imperative right away for the customer. And they go, "Oh, well, okay, I want that today for free. I'll take it." And she gets the package package price, and she does very well with that psychological marketing ploy. So it's something that I've learned. But suffice to say, it's best sold in a series because again, your skin's alive. This is a supplement that's deeply healing and regenerative and nutritious to the skin. So it only makes sense that you do it on a very consistent, regular basis. And one thing I know about the skin is it likes consistency and it likes regularity. It doesn't love trauma, which is why the movement in our business and pretty much everything that we do is a less is more approach, right? So the MCA, the monochloroacetic acid versus the trichloroacetic, if there's an advancement where we can get the same or better result using a less aggressive ingredient, why not? Next generation peel. If you can do a less aggressive microneedling with the stamping method and get the same result, why not, right? We don't want the skin to be overly treated or overly traumatized. And so this peel fits perfectly into that philosophy.
Good.
Is
Okay.
that it?
Any questions on AMiKO before we transition over to TalaDerma?
Did you have an ROI or is it just something we
Yes,
talked about? Okay.
it's
Is that
at
at the
the
end? At the end. We'll talk about it at the end. Sorry. And by the
yeah.
way, I'm so sorry. I know I speak quickly. That was actually me trying to slow down. So hopefully I wasn't too fast, but I live in New York and everything's quick, quick, quick. And I just took a 6-hour drive to Virginia and literally just walked into my hotel room. So I hope that that was clear. Please feel free to ask questions. I'm here for the entirety of the webinar.
So we have a couple questions on neutralizer. Do you want to answer that, or do you want me to answer that?
What are the questions? Do we have a
How do you neutralize? What neutralizer do you use?
Yeah, we are probably going to bring in something, but we sort of felt like everybody had a neutralizer already. So really any neutralizer that you might have in your cabin, the typical suspects, if you will, are the ones with sodium bicarbonate and a purified or a distilled water combination. Carla, I don't know what you use in your clinic, but
Yep.
anything like that is perfect. We apply it just with like a clean cotton 4x4 and just sort of remove it very properly and very carefully. I always pay attention to the nasolabial fold, the eyebrow line. Again, we talked about occlusion, but if you're not, really pay attention there. But anything that you've been using historically would work fine.
For those of you that just recently bought the peel, if you haven't scheduled your one-on-one training with me, or if you purchase from Vincent, reach out to us and get that scheduled because we'll touch a little bit more in detail about the neutralization with this peel.
Yes.
Okay.
Was that the only question?
Those were the two questions on
Oh, so
neutralization.
go
Yeah,
ahead,
go ahead.
Carla. That's
Oh, I
all
was going
you.
to say for cleanse and degreaser.
Yeah,
Got
go
it.
ahead. Because do you have something that you offer with TalaDerma? Because again, we kind of feel like everybody's got some products. AMiKO has a line of products called Auric, and you'll see it here. Again, I'm blurring, I know. So
That's the
if you
mousse
go
cleanser,
yeah,
right?
it's a mousse cleanser. It's kind of like marshmallow. It's really kind of cool there, but very effective. And that's because mousse cleansers in Europe, where this is made, are the most popular. But it's really soft and marshmallowy, very effective cleanser. So something like that, but anything you're already using is fine too. I always kind of go to Carla for my expert skincare advice because she's got such great knowledge of it and such great touch. She's been around and developed her own stuff. So but anything you're comfortable with, there's nothing really out of the ordinary. I wouldn't use a peel cleanser. I wouldn't use a high glycolic, salicylic, or lactic because we don't typically want to piggyback acid. So I would just do a thorough cleanse and degrease before the treatment.
Yep. And for your degreaser, if you have anything that you use specifically with your peels, you can do that. I know some people like to use just acetone or alcohol, depending on your preference.
Alcohol wipes are fine. Believe it or not, some people are using witch hazel. Whatever you've been historically using would work fine. We can give you some great recommendations at the end or contact us and we'll have a list of resources for you.
Perfect. And then as far as pricing, there's a question on that. I do have a slide on that and we'll go over pricing and ROI and all of that in more detail. Okay. Any other questions on AMiKO okay. If you think about it later on, just throw it in the chat and we'll continue with Q&A at the end. Okay, so TalaDerma. TalaDerma was born out of a need. So a lot of estheticians that I have been working with or helping out over the past few years, and I see some of you here in the audience, a common theme that I would hear from estheticians, whether it was a device and results from that, or other modalities like peels or things like that, was okay, I love the treatment, but how can I get better results with whatever it is, right? Pigmentation. How can I get better results with my acne scar clients and things like that? And the other thing was also, especially with needling, microchanneling, microneedling, another big question I would always get was, what can I use right after before I send them home? And there's not a lot of products that you can put on specifically for collagen induction, so your microneedling, your microchanneling, right after, because those channels are still open. There are a few products in the market that you can, and for immediately post, as far as like calming the skin and soothing it, there weren't a lot of options, and some of them were extremely expensive. So TalaDerma was born out of that need, that problem, right? Also with certain skin, right? Even though we're doing treatments to improve things, sometimes we had unwanted results, post-inflammatory hyperpigmentation, a lot of irritation and things like that. And that's really the heart of where TalaDerma came from. It was a missing gap. So the missing piece is the solution, right? So what do we do when we run into inflammation or we run into underwhelming results? Do we add more treatments? Do we add more downtime? Not necessarily, right? Better results don't usually require more time or more aggressive treatments. They require smarter support. I love, and I know many of you have heard me say this, I love to preach about that 80-20 rule, because as estheticians, I think a lot of times we forget about that. The 80-20 rule is the results and the outcomes that your clients are going to get is 80% what they do at home, 20% what we do in the treatment room. Okay, our clients are at home more than they are with us, and day to day, what they do for their skin is going to reflect the outcomes of their professional treatments. Your clients can invest on all the best professional treatments, but if they go home and they're not using if they're not using products, first of all, they're not going to get the best outcomes. And if they're not using the right products that are formulated to support their specific skin issue, they're not going to get the most out of those professional treatments that they are investing in. So the TalaDerma line, the heart of this line is NAD+. That's nicotinamide adenine dinucleotide. It is one of the most important molecules in the body for repair and renewal. NAD+ fuels repair at the cellular level. I like to think of it as, like, for example, with the AMiKO Peel, it triggers the growth factors and all of those things, right? Your growth factors are it's your cell phone, and the NAD+ is the charger, right? For you to get the most out of your cell phone, you need to have that charger. Otherwise, you're going to be running on low bat or no bat. So, so NAD+ is kind of the charger for your cell phone. Our formulations in TalaDerma contain recovery actives like peptides, antioxidants, soothing agents to help calm inflammation, support the barrier, and also reduce the risk of post-treatment complications like PIH. These products integrate effortlessly into the protocols that you're already doing. So you'll see here how easily it integrates with AMiKO, and it's kind of the same thing you would do with whatever other treatment you're doing. It's not complicated. It doesn't add any more time to your service either. So it's just a great add-on. So it's the missing piece that most estheticians are overlooking. Like I said, it's the what comes after. The boosters, which I'm going to cover in just a moment, and this line is really designed for the healing window. So if you're not familiar with that, the first 24 to 72 hours after advanced treatments, like your peels, your collagen induction, microderm, dermaplaning, whatever it is the healing window. During this time, the skin is open, it's more permeable, responsive to accept what we put on top of the skin. So the TalaDerma boosters and the ampules, they deliver NAD+, the peptides, the antioxidants to the skin during that window when it matters most. So whatever you're applying to the skin or not applying to the skin after these advanced treatments can really affect and change the outcome that you're going to get. So TalaDerma was built for this window. There's a question, is it going to be okay for those who has autoimmune disorder? Is that for the peel that you're asking?
That's
Okay,
the
for the
top one.
peel.
Oh, okay.
Oh, yeah. Did you want to answer that, Vincent, or do you want to?
I thought it was for your product. I didn't
Oh,
know that it was for the peel. So for the peel, again, if they're receiving any sort of antibiotic therapy or have an immune disorder, I would probably check with their physician. It just depends on what it is. If it's something that goes in and out of remission, it's generally okay because again, this is got deep nutrition to the skin. But we do have a consent form, so I guess it depends on what we're talking about. Is it like a
would
lupus?
say, yeah, I was gonna say whenever you're in doubt, because there's so many immune disorders, autoimmune disorders, there's so many medical conditions. If you're ever in doubt, especially with autoimmune, because there's many different autoimmunes and the severity that one has, and their health um is very different. I would always refer them to their physician unless you are a medical provider where you can diagnose or clear someone. I would say cover yourself and have them check in with their medical provider, especially with something like lupus. Psoriasis, if it is inflamed and active, you definitely don't want to do that. We don't typically work on inflamed or active skin, right? Because it can irritate it further. So yeah, so we have the consent form. There are the contraindications on there, but anything outside of that, I would say it's always best to lean on their medical provider because they know their health history best and medications and all of that. Okay, so we talked about the healing window, and we're going to go into the formulation. So for TalaDerma, there are 3 formulations in the line. Um, the they're targeted formulations. So it's very specific to certain skin issues, the common skin issues that we see in our treatment room. So the first one is going to be our VitaFirm. This one is about collagen support. It's about firmness. This formulation, along with NAD plus, because all our boosters and ampules have NAD plus in it. So along with NAD plus, which is our cell energy, it also includes copper peptides, specifically GHKCU, which is the gold standard when it comes to peptides, copper peptides. And that's for stimulating collagen, accelerating wound healing. And it also has matrixyl 3000 in this formulation. So you have 2 powerhouse peptides that are working together for real anti-aging results, and that's the VitaFirm formula. The second one is the LumiVive. This one is for brightening and pigment correction. You can also use this as a pre-treatment. So higher Fitzpatrick's 456, I always like to have them pre-treat before any advanced treatments to minimize the risk of post-inflammatory hyperpigmentation. So I will usually start my clients on a pre-treatment at least 2 weeks, if not more, before advanced treatments to minimize complications. So again, with LumiVive, we have that NAD plus. It's the base of all our formulations here. LumiVive also has arbutin, glutathione, 2 of the most clinically proven ingredients for pigment modulation. They work at different points of the melanin pathway. All the ingredients in here work at different points of the melanin pathway, which means they give you a more complete brightening effect. And then the third one is Cicaderm. And this one I will say is probably the most misunderstood formulation. This one is your calming and repair formulation. So it does say scars and stretch marks, and I will say that that is for early stages scar and stretch marks. So your red scars, acne scars, your red stretch marks, anything red or pink in the skin. So your rosacea, your very sensitive clients, this is the formula that you want for them. Also, the when we get to the booster is great for post-treatment for anyone that is prone to post-inflammatory hyperpigmentation. And I'll touch on that a little bit more later. So ingredients in here is, of course, the NAD+. We have Centella asiatica, which is one of the most researched botanicals for barrier repair and inflammation. We also have kojic acid in here, and that helps prevent PIH, which makes it a perfect choice after more aggressive treatments, specifically for those clients that are prone to it or the higher Fitzpatrick's. Also great for your rosacea clients. The three formulations here repeat across our two formats, our boosters and our ampules. So your clients have a consistent system that's easy to remember and recommend. So if you're using one in the treatment room, most likely you're going to recommend that for home care as well. So our boosters, these are, they come in syringes, pre-dosed syringes like this, and they are highly concentrated boosters, and these are designed for immediately post advanced treatment. So if you are doing collagen induction, you're not needling in with these, but you're going to apply it immediately after. In the case of your peel, like with AMiKO, you're going to finish your peel protocol and then you're going to come in with your booster. And that's pretty much the same protocol for just about any modality. So if you're doing a dermaplane or a microderm, hydroderm, laser, you're going to do your regular protocol, and then at the end, you're going to apply your booster. And you'll choose the booster that's appropriate for the skin that you're working on, for that client that you're working on. And I will say, much like with AMiKO and the dosing there, one syringe is a lot of product. So I can usually get, like for a peel, post-peel, I can usually get at least 2 treatments out of a syringe here. And in your training, I go over how to safely be able to break up your dosing from a syringe. So there's no added time, treatment time to this. So if your client comes in and they're coming in for the peel, and you see that either their barrier is not in the best shape, or maybe they're dealing with some sun damage from the summer, and you want to add a booster into their treatment and you recommend that, you can recommend it because it doesn't add any time to your service. And then we've got a little bit of a snapshot on the ROI there, but I believe I have another slide with more detailed ROI for the boosters on there. And like I said, the boosters are an add-on to just about any treatment. Immediately after microneedling, yes. Don't needle it in, but as soon as you're done, you can put that on before your client leaves your treatment. And then the ampules. The ampules are the extension of what you've done in the treatment room. They're going to continue to use that at home, again with the same 3 formulations. So I'm going to show you here the VitaFirm. The VitaFirm, like I said, it has GHKCU, which is that copper peptide. It has a blue color. It's a signature blue color, and that's what makes the formulation blue. It's the GHKCU copper peptide. There are no dyes in these formulations. So that one is the VitaFirm. Then you've got the LumiVive. And that one is that. This one also has, I forgot to mention that, 2 stable forms of vitamin C. It has MAP and THD, so magnesium ascorbate phosphate. Oh my gosh, my words. Phosphate and tetrahexyl decyl ascorbate. MAP is a water-soluble form of vitamin C, and your THD is a lipid-soluble form of vitamin C. Again, very stable forms of vitamin C, non-irritating to the skin, like your L-ascorbic acid or something like that can be. And this one is the Cicaderm. Oops. It's almost empty. And that's your Cicaderm. So these go right into the skin. They give they soothe and they hydrate the skin. They're not sticky, and I've already put 2 products on here. They're not sticky, and this is what they would use at home as an extension of your professional treatment. You can also use this if you're doing just your regular facials. You can use this in the facial versus using a booster, because again, the boosters are more concentrated for those advanced treatments so that they can go in deeper to the skin. But if you're not doing an advanced modality and you're just doing a facial, you can use the ampules for that. When you use boosters and ampules to help enhance the professional treatments that you're doing, It does increase compliance, right? So you're going to get better outcomes with your professional treatments. It also increases your client satisfaction, which in turn will increase your rebooking rates, right? When your clients are happy, they're more likely to come back for more, and even like recommend their friends and their family to come see you. So and I will say, don't be afraid to recommend home care. I hear that all the time from estheticians where they're like, well, they already spent money with me. I don't want to, I don't want to have them spend more money. Let your client make the decision, right? They are spending money with you, but you want them to spend that money wisely and to get the most out of it. So supporting that at home is going to be key. The last product in the line, and this is the only product that does not have NAD+, and that is because NAD+ is water soluble and not oil soluble. So it's the Biome Restore oil. To be able to get the NAD+ in here, we would have had to put emulsifiers and binders and things like that. And this was designed for immediately post-treatment and specifically post-collagen induction. So those of you that are doing collagen induction, you know that when you're done with a treatment, the skin can feel a little bit dry, tight, itchy, and a lot of times we send our clients home and they're not supposed to put anything on until the next day. This is formulated for that and for any of your advanced treatments. So you can put this on in your treatment room. You can also send them home with this and they can use it as much as they need to from the moment you're done with your treatment on. And this one, it is an oil, but it is, it will absorb into the skin. It's not going to sit on and stay oily. You can see that there. It will absorb into the skin. So it's already absorbing on there. If you give that another minute or two, it's not going to be oily and it just leaves the skin very nice and soft. And this is also safe for post any advanced treatment. I have some clients that are actually using it for dermaplaning. If you use oil when you dermaplane, they're also using it for that. Safe post laser. I actually just had a CO2 laser, I think about 5 days ago. So I was using my ampules immediately after, like the next morning after, and then the oil about 24 hours after. And this is post CO2. I have nothing on my skin except for non-tinted sunscreen. And it is, like I can see some browning and things like that, but my skin is very comfortable. It's not like dry, tight, or anything like that. So that is the Biome Restore oil. And I will say that is a bestseller or really easy sell for most estheticians. I know some of you here who have sold out of this several times already. And it's a great, not just post-treatment, but like for me, this is my moisturizer. I've been using it for almost a year now as my moisturizer. And you just need about like 4 drops for your full face, not even a full pump. All right. Oh, we got a video. I hope the audio works this time. We have a video. It's a quick video just showing you the protocol of the AMiKO Peel, followed by the TalaDerma and the boosters.
Before starting, make sure your tray is set up with all the products and tools you need for the treatment. Hold the peel vial firmly and with a small pair of pliers, grip the circular tab in the center of the metal top. Lift and twist gently to remove the tab. This will expose the rubber stopper while keeping the rest of the metal band intact. Using a blunt tip cannula attached to a syringe, drop the correct dosage for the treatment area. Remove the cap from your TalaDerma booster and attach a blunt tip cannula. Cleanse the skin thoroughly using auric cleansing mousse to remove all impurities and prepare the skin. I like to first remove my cleanser with dry 4x4 aesthetic wipes, followed by a damp towel or facial sponge. Make sure the skin is completely dry before application. Using your gloved hand or a fan brush, apply an even layer of the peel to the skin. Do not massage. For the face, leave the peel on for 3 to 5 minutes. Remove the peel with 4x4 aesthetic wipes dampened with cool water. Continue until all product is fully removed from the skin. For sensitive or reactive skin, follow with a neutralizer, even if there's no visible reaction. Use any professional grade neutralizer you have. Apply your chosen TalaDerma booster while the skin is in its most receptive state. This delivers NAD+ and actives deep into the skin to speed recovery, reduce downtime, and boost results. Wait 3 to 5 minutes, then apply a few drops of Biome Restore. If needed, follow with the AMiKO post-treatment cream and finish with a broad-spectrum SPF 30 or higher to protect the skin.
So here, I'm just going to go through some photos really quick. The top left photo, that is a combination treatment of the peel and I can't remember exactly. I think at least 1 or 2 collagen induction microneedling sessions on there using Lumivive at home. Sorry, booster in professional treatment. At home, they're using Lumivive in the morning and the VitaFirm at night. You can use the same ampule day and night, but for pigment correction and for anti-aging, I love using the Lumivive in the morning and the VitaFirm at night. And then the one in the upper right, that is 1 session of AMiKO. I did use the Lumivive booster on her because she came in saying that her skin has been looking dull. So we used the Lumivive there. So that's AMiKO Lumivive Biome oil, and that photo is about a week out, or just under a week out from that session. And then that bottom photo there, this is like one of my favorites. This is a client that had a chemical burn from an at-home peel and dermaplaning. That top photo doesn't even show how the condition that was in. She had blisters on there pretty much. And she was using just the Biome oil. She put it on several times a day. That photo is like 24 hours. And you can see the difference that it made there. And then we've got more AMiKO. Oh, and then there's some quotes there from some estheticians that are using the TalaDerma line. And then we've got more before and afters here. And you can see, like, clients that have a lot of redness or rosacea, this peel can be used on those clients as well. All right, so let's talk about money. Okay, this is for AMiKO only. So if you can see the ROI for each of these separately, imagine what you can do with them together. So this is for AMiKO. Vincent, if you want to take that, or
Yeah, so I had kind of mentioned this earlier, but again, you get the 5 vials. They are 10 milliliters each. I will tell you, one of the competitive things about this is most of our competitors have 5 milliliters each. So this is really double the liquid, so you get double the amount of treatments out of it, which makes it much more much greater return on investment. Again, the average cost per treatment is about $22, give or take. Suggested treatment price $250. So profit per box, you're looking at about $4,500 to $5,700 per box. So that's when I did my market research, because I've sold some other peels prior to this. That's amazing. That's really, really great. That's 25 treatments. You could blow through that in a month. So if you're looking at about $5,000 in revenue and a box a month, 12 months, that's $60,000 a year just in peels, just in a 10-minute peel, if you were to do it that way. Pretty amazing.
And I will say, I book these on 30 minutes. So I'm a little bit different because I don't do a lot of the luxurious part of facials. Mine are very straightforward. So I book these on 30 minutes.
Yeah, and again,
okay.
a lot of your clients are used to going to a doctor's office. You'd be surprised, question them, and they're doing VIP lunchtime peels in 15 minutes and charging them $300 to $500 or more because they have the MD after their name. So this really can make you quite competitive, and you can capture that market. More importantly, you're delivering deep nutrition to the skin with the colostrum. It's not like we're just doing a peel and getting a tight, smooth result. We're actually changing the inner nature of the skin, the metabolism, the cell-to-cell communication, the production of collagen, and correcting chronic skin conditions. And if you go to our website, there's some even better before and after photos there at it's AMiKOPeelUSA.com.
Perfect. Okay, and then let's go over ROI for the boosters, the TalaDerma boosters. So one box has 5 syringes in it, and this is based off of using 1 syringe per client, right? But like I said, you can definitely get more more than one treatment out of a syringe there. So if the suggested add-on price for the boosters are about $75 to $100. If you're doing one booster per day, that's an extra $265 for your week, which may sound like not so much, but if you look at your annual revenue, that's an additional almost $13,000, right? For not having done any more time, you're doing the treatments you're already doing. And then even better, like I love using this not just as an add-on, but getting creative with marketing, right? Bundles, your packages. You could do, for packages, I love doing value added. And just with anything, I really like doing value added versus just discounts. So if you were doing a package of peels, right, you could, instead of discounting the peels, you could add this on as a value add. When you purchase a package, you're also going to get a booster. It's a really great way to value add versus discounting your services. I don't like the discounting services personally, because when you discount them, those clients that come in for the discount, when they have to pay for it, you know, at the regular price, they may or may not come back, and then it kind of just devalues the service that you're offering. So I prefer doing value add. And this is something that you can add to, like I said, all your other advanced modalities. So your collagen induction, if you're doing lasers and things like that. So if you are doing collagen induction, like for me, my collagen induction starts at $350. I book it on 60 minutes, but that includes turning over the room and everything else. So instead of $350 for that same 60-minute appointment, I am now at $425. Right? I didn't add any more time. There's a value add for my client. She's going to love her results even more than when we were doing just the one modality. Now she's got the add-on, and again, no extra time, just more revenue and better outcomes for your clients. Any questions on that? Or before we?
Carla, these products are not available in any stores, or it's an
No, your boosters are professional only. The ampules are for, you can retail that to your clients, and then like I said, you could use them in your facials, but these are retail home care. The boosters are professional only. Your clients are not going to be taking these home. The oil is also, that one is also multi-purpose. It's for professional and for home care use.
That's an
you
amazing.
Could also, yeah, so also for packages, like I love doing packages is doing value add-on for their home care, right? Because then you know that they're getting the professional treatment, plus they're going to have what they need at home to support those professional treatments. It's also, especially for your clients that are resistant or don't really comply with home care, it's the best way to get them on home care. Because if it's part of their package, they get to use it, they see the value of it, they see how it feels and what it does for their skin. So when they run out of this, it makes it easier for them to repurchase it. And that goes for pretty much anything. And then thank you, Bridget, for sharing that. Yes, she had an event in August with the client that has TalaDerma, and she sold out that evening of the ampules. So it really is, it's not meant to replace your skincare lines. And that's really where this was designed, was kind of like, if you have your skincare routine, this was designed for that middle part, right? Like there's no cleansers, there's no moisturizer. We have the oil, but not a moisturizer. And it's really what's in the middle. Because when it comes to treatment, yes. Because what you do in the middle of your skincare, like your serums or ampules, the ampules are serums that are more concentrated. So that's why they're called ampules. The ampules go in the middle, and they're the ones that do the work, right? And so that's really what it is. So if you have skincare lines that you're already retailing, you can still pull from that, and this kind of just works into those routines.
Sorry, because I'm in the business. How would you offer that to a client who's using, let's say, a retinol at night or a prescription tretinoin? How would you alter? Would you have them use one in the day, the retin-A at night?
Perfect. Thank you for that. So like I was saying, I use the LumiVive in the morning. That's my brightening, my antioxidants. And then at night, I use the VitaFirm, but I alternate my nights actually with the Auric night cream, because that one has a little bit of retinol in it. So I will alternate. Yep. So I will alternate my nights with this and the Auric night cream. Yep.
By the way, there's a moving trend about that. A lot of derms are now saying to just use retinols a few times a week and cycle on and cycle off. So something to consider.
Yeah,
So there's
exactly.
always room for a treatment product like those.
Right. Okay. So, any questions before we conclude? Any other questions? Nope. Let's see. Is this from Bridget? I worked with a skincare rep of another brand and we built skincare systems together. It was amazing. Yes. You really need to, for clients, if you want your clients to be loyal to you, to keep coming back to you, you really have to give them full service. And that means not just what you're doing for them, but making sure that their home care and everything else is covered in that.
Great.
All right. So, and then again, for anyone that has purchased either the TalaDerma or AMiKO, if you have not scheduled a one-on-one, please contact us and let's get that scheduled so you can start working with your systems right away.
Yeah, I mean, we're here to support you. We want to see results. We want to see great things, great photos. We want to get feedback. And we want, at the very end of the day, for you to make a great income for you and your family while delivering transformative results to your clients.
Yeah. And that one-on-one, I mean, for TalaDerma, you can see it's pretty straightforward, but you still have that one-on-one available to you. But with AMiKO, we really want you to schedule that one-on-one because outside of the standard protocols, there are other things you can tweak or do. And that's something that we can go over with you when we're on our training.
Thank you. That's great.
Yep. All right. So if there's no other questions,
No
we'll let you
questions.
guys go. No? Well, thank you so much for taking the time out of your, today's Monday, to join us. And if you have any questions after this, please reach out to Vincent or to me.
By the way, they can go to either website and just enter their email to continue to get email updates. If you're not ready for something today, you will get promotions, specials, new products that we launched. So maybe just go in and put your email. I imagine we must have it because we invited you to this, but maybe
Yes.
not. I don't know.
Yes.